The way I approach patient care is first, listening to their story. I think that's the most important part. And that's the most important part in neurology, is really the story. Getting very fine details, specifics of the symptoms that they're going through, both at the time that you're seeing them, but also prior. So really getting a comprehensive history, then doing the neurologic exam, and then sort of putting those two together with an idea. Does this fit kind of my concept or construct of what I think of MS or other diseases around MS? And then really trying to put the whole puzzle together. My name is Matt Schindler. I'm a neurologist at Penn Medicine. I'll get consults for patients that have already gotten the diagnosis of MS and they want to come into more of a comprehensive MS center, which Penn has. So we have a large team who all work to take care of our patients. And I think some people really want that sort of larger, sort of team-based approach. We do get a lot of consults for question about, here's a person who has symptoms, is this MS? Or here's an MRI where the concern for MS was raised and they want some expertise in sort of being able to diagnose patients with disease. And, at an academic center like Penn, I think we are in a good state to be able to do that. We have spent a lot of time optimizing our clinical imaging so that it is at the top of the line for us to be able to diagnose people with MS. Also to, sometimes remove the diagnosis of MS if it's a wrong diagnosis. So being able to differentiate between diseases that have overlap. And then in our Neuro COVID Clinic, we do see patients who are often referred to us by Penn's larger COVID clinic, which is run by our PM&R folks, who will send them if they're having neurologic symptoms related to their disease. And so I'm one of 4 different neurologists who are involved in that clinic, and we'll see them and evaluate them and sort of talk about sort of what we know, what we don't know about this sort of newer disease that's out there. Well, if a patient chooses me for their provider, they should expect somebody that is going to ask a lot of questions, and I may ask for a lot of details, but I'm somebody that likes to teach. So I like to teach my patients, educate them about what I know about the disease, and try to make them experts in their disease, because I think it's important to be a part of. So I think you'll get somebody who's passionate about their disease, somebody who wants to, find out how to fix their disease. I think that's sort of what that clinician, scientist type person is. It's, it's a little bit of spanning 2 worlds, but what we want to do is try to bring those worlds together, and ultimately it's all to try to make people better.